So, when I met Elissa as a 10th grader, I was struck by her passion and her conviction and her ability to make me even question my planning abilities, because she's a planner. And I thought I was a good planner, but Elissa is a great planner because she knew as a sophomore what she envisioned for her senior project. And she thought about, as a sophomore, what do I need to do now and next year so that I can have the kind of experience I want to have for my senior project. And that's very impressive, because she knew that if she wanted to shadow a pathologist, that she would need to know human anatomy. And so she would need to plan her schedule accordingly so that she had taken anatomy prior to senior year. And she knew that she was going to have to reach out to professionals, because we didn't have pathologists who would give her the kind of access she wanted as previous mentors. She was going to have to be an opener of doors. And she did, so you can all say thank you. Right. And I know that you're going to learn a great deal today and be as impressed with her process as I have been. So please welcome Elissa.
As Mrs. Graves said, my name is Elissa Cleland, and welcome to my presentation, The Path to Pathology. I Saw Dead People. So, what is pathology? The general definition of pathology, as defined by the medical dictionary, is that pathology is the branch of medicine concerned with the nature of disease and how it affects the various tissues and organs of the body. But what most of you probably think of is this. So these shows were what I imagine the life of an everyday pathologist to be like. Characters like Melinda Warner from Law & Order SVU and Ducky from NCIS used an exciting branch of science called pathology, although I know now it's a highly romanticized form in which they receive talk screen results in a matter of seconds. What I wanted to know and take away from my senior project was, what is pathology really like? And before I start out on my pre-med journey, can I even handle it? My senior project focused on the branch of pathology that most regularly affects your everyday life, clinical pathology. Clinical pathology, according to the medical dictionary, is the laboratory study of disease by a pathologist. So every time you go and get blood drawn or tests done, a clinical pathologist is the one that's identifying what's wrong with your tests and giving you your results. I had the privilege of shadowing a clinical pathologist, Dr. Green, at Norfolk Sentara General Hospital. The hospital was perfectly set up for shadowing opportunities, so I joined the volunteer program easily and was able to shadow him from June through August. My typical day with Dr. Green consisted of looking at many slides in his office. Dr. Green had an attachment to his microscope that allowed us to look into the microscope simultaneously so I could see everything he was seeing. He also had a little pointer tool so that he could point out specific aspects of the slides while he was explaining them to me. He was also kind enough to loan me one of his textbooks, The Pathologic Basis of Disease, so I could look up things at home. The textbook was college level, so it was a little bit over my head, but it still helped a lot. He also pulled books out of his bookcase to let me read about specific tumors or conditions when we came across them in our slides. A lot of the time, however, Dr. Green's explanations made a lot more sense than the textbooks. One of the most common types of cancer I saw was breast cancer. There are a couple different types, DCIS, which stands for ductal carcinoma in situ, in which the abnormal cells are confined to the mammary ducts. And there's also invasive ductal carcinoma, which is pictured here. Invasive is more likely to metastasize because it has already invaded the surrounding breast tissue. The general trend is that if DCIS is left untreated or isn't completely resected, it will eventually transform into invasive carcinoma and then metastasize. I also saw this case in which there is an intraductal pancreatic mucinous neoplasm. So those are a lot of words that just means that there's a neoplasm, which is a tumor, inside a pancreatic duct that is producing mucin. So the picture to your left is a zoomed out picture, so you can see the entire pancreatic duct. And the picture here is zoomed in, so you can see this is the neoplasm, and this is a benign pancreatic tissue. You can also see here that this thin substance that's coming off of the neoplasm is the mucin that it's producing. So you can tell that it is intraductal, it's confined to the duct, because you can tell, which I just showed you, the benign pancreatic tissue it's benign, so it hasn't invaded into the pancreatic tissue. However, intraductal pancreatic mucinous neoplasms can transform into invasive pancreatic cancer and should be removed. Another case I saw was this papillary thyroid carcinoma. This is the most common type of cancer in the thyroid. It arises in irregular solid or cystic masses, and the cells form distinctive papillae, which are nipple-like structures. So if you can see right here, the cells are forming into curved little, they're called papillae. The majority of my time was spent looking at and identifying the cancers in slides such as these. It was extremely difficult because each type of cancer behaves slightly differently, even if they're affecting the same part of the body. When I wasn't looking through the microscope, I was observing Dr. Green in the aptly named gross room. So the gross room was where Dr. Green went to look at frozen sections, which are slides made when a doctor or surgeon needs a quick diagnosis. I also got to watch Dr. Green make the gross inspections of the organs before turning them into slides. He would cut through it to see if there were any abnormalities macroscopically before setting aside small segments that would later get turned into slides. So these really tiny slides would get fixed in wax as opposed to frozen because the wax is better for long-term use. All things taken out of a patient's body are sent to the gross room, whether it's an appendix from a routine appendectomy or a medical dispenser implant from a patient who's using chemo. Dr. Green would record his observations while cutting at the table pictured to the right. He would then paint one side of the organ a specific color and the other side a different color, so that on the slide he would be able to identify the gross margin and be able to orient himself on the slide. The tissue samples for a frozen section are first placed in an isopentane bath, which is this here. This is the isopentane bath. Then they're cut 4 microns thick. So for comparison, a red blood cell in your body is only 7 microns thick, so it's cut even thinner. This machine that's pictured here uses an assembly line-like process that dips the slides in various amounts and concentrations of chemicals, water, and dye. The most basic stain that pathologists use is an H&E stain, which stands for hematoxylin and eosin, and it stains the nucleus of the blue and the cytoplasm of the cell pink, respectively. This slide is of benign breast tissue because I put it in here to show you how the nuclei have been stained pink, purple by the hematoxylin, and the surrounding cytoplasm and connective tissue have all been stained pink by the eosin. However, there are other stains that can be used by pathologists to show exactly what kind of cancer cells are on the slide. For example, I saw a lot of a stain called CKC, which shows that cancer cells on a slide are most likely carcinoma, which are cancer cells that arise from a specific tissue called epithelial tissue. So the following slides are pictures of organs and different things that I saw in the gross room. So if you're a bit squeamish, you probably shouldn't look. Trigger warning, sorry. So here's an endometrial cast all the way to your left. It's a fleshy, hollow sac that a woman passes when the endometrial lining or the uterine lining is thickened. When it is shed, it resembles a fleshy piece of tissue. It is called a cast because it takes the shape of the uterine cavity. So this picture is taken after Dr. Green's gross inspection, so it's been all the way cut through to look for macroscopic abnormalities. And you can see in the corner here, there's a little white tray. Those little pieces are being set aside so he can make slides. The other picture is a gallbladder with gallstones after a cholecystectomy, which is a gallbladder removal. The gallstones are hardened deposits of digestive fluid that can form in a gallbladder and cause pain if they block a bile duct. I also saw twin placentas, one of which is pictured all the way to your left. It included the amniotic sac, which is that kind of fleshy stuff that's kind of moving off, and the umbilical cord, which is that white thing right here that kind of looks like string cheese. And then the placental disc, have fun eating string cheese again. So the placental disc is that kind of fleshy stuff underneath. The other picture that as you see to your right is a radial head that snapped off due to a pathologic fracture, which is a fracture that occurs due to disease rather than being pushed. So there was no force that was applied to break the bone. We had to decalcify the bone first so that would be soft enough to cut to make into slides. The bottom picture was the first things I ever saw in the Gross Lab, and it really made me love it, and they are uterine and cervix samples that were being cut to form slides. So I spent 2 days with Dr. Tahan, who is a hematopathologist in the transfusions lab. We looked at peripheral blood smears, which are pictured to your top right, to see if patients were anemic or had infections. He pointed out to me what each type of blood cell looked like underneath the microscope and showed me the different types of red blood cells as well as what they mean for the patient. For example, there's a teardrop cell, also called a dacrycyte, which means that the patient could possibly have myelofibrosis, myeloepiphysic anemia, or a variety of thalassemias. I also looked at hemoglobin electrophoresis gels. So these are gels that show which traits an individual has by the little marks that are left on the gels. So these little marks here. And there are different types of hemoglobin, which I have listed here. And this is a guide that Dr. Green had up to show what each little mark correlated to with what trait on the gel. I saw a few with the S trait, which is the sickle cell anemia trait, and they were all isolated and put onto one gel. So you can see in the picture they're in wells 3, 4, 5, 6, and 7. And well 7 is actually really interesting. It's pretty rare to see that it was a double heterozygote for the S trait and for beta thalassemia. So all that means is that an individual was heterozygous at 2 different genetic loci, one for the location for the S trait and one for beta thalassemia. So you can see this mark here is for the S trait because all of them have it, and this mark up here for well 7 is the beta thalassemia trait. So my favorite part of my mentorship was the autopsy I was able to witness. I had to get completely dressed out, which meant a gown, a face shield, 2 pairs of gloves, scrub bottoms, and booties. So along with Dr. Green, a person called a diener who works for the medical examiner's office came in to help set up the morgue. She had already started working, so by the time Dr. Green and I walked into the morgue, the cadaver was already out and being prepped. It was a lot different than I'd expected. I thought it was going to be like an episode of Law and Order where the deceased was going to be covered by a nice white sheet, but he was not covered at all. So while Dr. Green went to get the paperwork, the diener, who didn't know that I was only 17 at the time, asked me if I could help her push him over so we could put a back prop underneath him so we could get a better angle at his chest. So I did. And then Dr. Green came back and he had to tell her like, she can't do that, and because she thought I was a medical student who was on a pathology rotation. The patient was obese, so he was actually 6'2" and over 300 pounds, so we could not lift him up onto the slab, and we had to conduct the autopsy on the gurney he'd been wheeled in on. When the diener made the initial incision, she popped his stomach, so the entire room kind of smelled like rotten eggs. When we cracked the ribs, we had to suction out all the fluids that were the result of a collapsed left lung. When we scooped out the blood from his chest cavity, it was a congealed jelly-like solid that we put all in the scale at once, and we found that 20% of his entire blood volume was just sitting in his chest. Specifically his mediastinum, which is the central chest cavity that lies between your 2 pleural cavities, and the left pleural cavity, which is why his left lung collapsed. The entire internal viscera were removed by Dr. Green at once and then examined individually outside of the body. I filled out the autopsy sheet, which is pictured up here, and so Dr. Green would read out the different weights and the characteristics of all the organs. So I jotted down things like the weight of the heart and the condition that the liver was in, but sometimes it was hard to hear him over the sound of the bone saw that was going. So the cause of death was an aortic dissection, which means that the patient's blood pressure was so high that it ripped a hole in his aorta, causing him to bleed out into his chest. I was able to see the tiny hole that was made in the aorta and the dried blood that was left in the sheath that covers the aorta. A few weeks later, I was able to see the slides that were made from the pieces Dr. Green had cut from the organs. So I could see the congealed blood that was left in the aorta underneath the microscope and the bits of brain tissue we'd set aside. It was nice to see the case from start to finish. For my product, I taught 3 anatomy classes about different abnormalities in tissues. I chose to do a lesson because I knew only anatomy students who have a background in tissue basics would be able to take anything away from the in-depth presentation I wanted to give. I also knew that it was the perfect time because the magnet anatomy classes were just finishing up their tissues unit, so I'd be able to help wrap things up for them. Here's a slide I used in my PowerPoint. It's a picture of lung tissue, specifically the alveoli, which has been infected with tuberculosis, which is those pink little flakes there. So I included this slide to show that pathologists can use other stains to not only stain for cancer, but for bacteria and even fungi as well. Before my lesson, I put students in groups and asked them to identify from a set of pictures which they thought was the typical tissue and which they thought was atypical, and to tell me why. Most students couldn't say exactly why it was atypical, just that it looked strange. After my lesson, I gave students a similar quiz to show what they had learned. And 62 out of 79 students, or 78.5%, got all the questions on the final assessment correct. Along with dispelling some idealistic notions about pathology, I also realized some things about teaching. Coming up with a lesson plan is hard. I didn't think my plan out thoroughly enough, and so my pre-assessment data could not be compared to my final assessment data because they were being divided out of drastically different numbers. So the pre-assessment data was being divided out of 3 because those pictures were used for 1 group per class, so there was 3 groups total. While each individual question on the quiz was out of 79 because each student answered that question individually. Therefore, the data was extremely skewed to show that they knew more after my lesson. It was a major oversight that if I had the chance to revise my lesson, I would avoid by just making students take an individual quiz both before and after. I also learned to admire teachers' ability to quickly put a class into even groups, even if the total number of students there are not divisible by the number of groups needed. I was struggling to split 28 kids up into 5 even groups. My overall experience was extremely positive. It showed me what pathology was really like and has steered me in a more concrete direction for my academic future. It also exposed me to a myriad of unique experiences like the autopsy that will set me apart from my fellow pre-med students in college. The autopsy was so amazing. It really solidified that this is the direction in which I want to take my life. I also enjoyed the interaction with other doctors. It was cool to meet surgeons and hematopathologists and other pathologists on staff. There were very few negatives, but we did sit at a desk for a very long time, even though I enjoyed looking in the microscope while I sat. And looking at similar slides could become monotonous, but because no cancer cells ever really behave the same way, similar cases were still very different. I would like to thank Dr. Green for letting me shadow him this summer. I deeply appreciate how accommodating and willing he was to explain basic concepts to me. I would like to thank Dr. Tahan for the very interesting days I had in the transfusions lab. I would like to thank Mr. Bostic and Mr. Benninger for allowing me to come into their classes to teach. I'd like to thank my mom for driving me around and listening to me practice like midnight. And I would like to thank Mrs. Graves for her great support and guidance since freshman year until this moment and keeping me calm when I was freaking out about the snowstorm. And I would like to thank all of you for coming to listen to me today. Yes, question?
With this profession, do you only observe the organs after they're removed, or do you also help with as part-time?
I'm sorry, I can't hear you.
With this profession, do you only observe the organs after they're removed, or do you also help to remove them?
Okay, so the question was, with this professional, did I get to only see the organs after they were removed or while they were removing them? So when it's a major surgery, I was the one who got to see them after they were removed. But there were times where I got called down to CT, which is like, just like me, you've been in like the giant MRI machine. And so we needed to be called down while the patient was still under. And so we weren't in the surgery room looking, but we had to look, because they took like a quick like biopsy. So there was one woman who had like little nodes in her breast. And so we had to go in to make sure that she didn't have cancer again, because she'd already had her breast removed. So we went in while she was still under and still had the needle in her. So I wasn't actually the one helping take the organs out, but I was allowed in when they were. Yes.
So, sophomore year, if you remember, we read the Henrietta Lacks book.
Yes, I do.
Was there any talk of that in the lab? Like, did the doctor that you work with, did you like talk about it at all, or was that like important information that they talked about?
So the question was, we read a book our sophomore year called The Immortal Life of Henrietta Lacks. And he was asking if in the pathology lab, if my doctor talked about that case at all. And no, he didn't. Because we weren't really like, because that was so important because she was growing, the cells were growing, and that's why it's the immortal life, is the cells were still growing. In the lab, we aren't growing cells. So it wasn't as, we didn't talk about it. Yes, that's right.
You said you were able to disprove some of the stuff you see on TV about how fast everything happens.
Yeah.
Like, you did one of the autopsies from the very beginning to the end. Like, what was the time frame behind that? Like, how long did that take, and how long, like, movies were like, hey, give me a tox screen now?
Yeah, okay. So, Coach Mack asked me, with comparing to how fast everything goes on TV, what the actual timeline is like for an autopsy. So the autopsy, we did a complete autopsy, which means we did the entire like chest cavity, we did the brain, we did his whole body. And that was actually it did not take very long. It only took probably max was 45 minutes, which was surprising. But getting the slides made took longer. It probably was like 2 weeks later that I got to see the slides that were made. So a lot of times on TV, they're like, oh, they come back immediately in the middle of the case and like, she had cancer, she was pregnant. Like they immediately knew like her baby had cancer. Like they knew everything. So like, that's not what it's like at all. It takes like a really long time for those kind of results to come in. And so those ones, it took 2 weeks for those to come in, and it was only I got to only see two. We took segments of each organ in the body to be made in slides, and we only really got the ones that were made from the aorta and the brain. So I didn't even get to see all of them really. And it depends on what lab you're into, because if there are more organs if you're a busier hospital, it takes longer because there are more slides being made. So.
You have time for one more question.
One more question. Jack.
Does your mentor work with law enforcement at all, or do they have specific pathologists that do?
Okay, so Jack asked if my mentor worked with law enforcement at all, or if there are any pathologists that are specifically for law enforcement, and there are pathologists that are specifically for law enforcement. So clinical pathologist is actually ones that work in the hospital. So a clinical pathologist wouldn't be working in tandem with the police department. They're responsible solely for the hospital ones, if they're hired by the hospital, because they're the ones making sure that the patient didn't die because of something the hospital did. So it's more of like a legality thing. And they have those are more forensic pathologists that work with the police department, which is actually what I want to go into. I would rather do that than work at a hospital. And so they're the ones who actually get to go to the crime scene too and look around, because they're forensic, so they put all the pieces together. So that's like difference.
Fantastic job. You'll leave Elissa's feedback for that case.